For too many years, families of children with devastating illnesses have felt helpless as they watch their child suffer. Today, they're taking matters into their own hands and finally finding relief treating their child with cannabis. These are their stories.
Hey guys, welcome to another episode.
Hello.
Today we have an interesting guest coming from the UK.
Yes.
Miss Hannah Deacon. She's a medical cannabis campaigner, as well as a director of a program at Maple Tree Medical Cannabis Consultants, and she's also an executive director of the Medical Cannabis Clinicians Society. Welcome, Hannah. Welcome.
Hi, thanks so much for having me.
Oh, this is awesome. You know, it's we've talked to so many people in the industry, whether it's from the medical side or recreational side, but it's in the U.S. or Canada. Haven't had anyone on the other side of the globe. Thinking about, especially when it comes to the U.K. and how are you guys doing, and also basically how did you get into the cannabis realm? I'm assuming that you had no interest in it, and all of a sudden now you find yourself in it.
Yeah, I mean, basically my journey into medical cannabis pretty much started in 2016. My son, Alfie, he's now 9. He was born in 2011, and in 2012 he had catastrophic seizures where he had thousands of seizures. He was in hospital for 4 months. He was only 8 months old when this happened. And he was in intensive care. It was just horrendous. You know, we went from having a little baby who was perfectly fine to being very, very poorly. And the only medicine that he responded to was intravenous steroids. So he doesn't respond to antiepileptics. He only responded to steroids. And we were sent home after 4 months in hospital and told he had immune responsive epilepsy. They didn't know what would happen to him. He may be okay, he may not be okay.
Wow.
And it was horrendously traumatic. And we carried on with life as you do. And he became unwell again after 8 months after the first cluster of seizures. And he kept doing that till he was 4. And then at 4, his seizures started to come every 3 weeks. So he had these huge clusters of seizures requiring intravenous steroids every 3 weeks. And then by the age of 5, he was having 150 to 250 seizures a week, requiring up to 25 doses of intravenous methylprednisolone a month, which is basically an intravenous steroid. And we know that steroids suppress your immune response. So,
yes.
And then he was diagnosed with a condition called PCDH19, which for us is a non-inherited genetic mutation, which causes clustering seizures, mild to severe learning delay and behaviour problems. And doctors said to us, well, we don't know what we can do for him. There's only 9 boys that we know with this diagnosis in the world. So there's no research, there's no understanding. There's about 20,000 girls. It affects girls more, but again, many of them are in America, and there's only 1 or 2 in Europe. So it's very, very small amount of children affected. So there's very little understanding. And in 2016, when Alfie was so severely ill and I was taking him into hospital every week in the back of an ambulance at 2 or 3 in the morning, which is when his seizures start, always at night, I just thought, well, I've got to try and help him. You know, I can't just sit back and hope the doctors find a cure, because that's never going to happen. And that's when I started to basically took to the internet and tried to find a replacement for the steroids. And cannabis just kept coming up as something that could work. And you know, that's what took me on this amazing journey of discovering what this plant can do. We obviously couldn't access it in the UK at that time. It was illegal, a Schedule 1 drug, you know, of no medicinal value. So in 2017, after raising money to go, we went and lived in Holland, where it is legal to prescribe for 5 months. And the medicine worked. And we came home in 2018 and ran a very effective campaign with a lobby group called End Our Pain, and that was very successful. And in June 2018, Alfie, my son, received the first permanent medical cannabis license for prescription of a cannabis-based medicine on the NHS. So, wow. You know, that's a very brief synopsis of my story, but that's how I ended up working and advocating and campaigning for better access to safe medicines for children like my son, and for all patients, to be honest. Any patients that believes that they should have access to medicine on the NHS, I try to represent them and work very hard to get access for them.
Oh my God! I mean, bless you, and the strength in finding the empowerment through this plant to help your son. Like, that's a major decision to make, to like move literally to another country just to help your child.
Yeah, I mean, we were in a terrible state. I was very traumatized. My family were falling apart. I had a daughter at that time. By the time my son was 6, when we went, I had a daughter who was 3. When Alfie did have seizures, he became very violent and aggressive because of all the steroids he'd been given and all the seizures he'd had. And my partner's 6'3" and used to play rugby, and I just had this vision of, not being able to look after my child if it carried on, or him passing away. And people say that, they say, you must have had a lot of strength to do it. Well, yes, I did. I decided to fight, but actually facing my child's death is far more frightening than anything I've done.
Absolutely.
I don't want to do that. So I've had to fight for him. And it is very sad because there is so much fear and stigma around the word cannabis still in the UK.
Oh, yes.
Many doctors are very fearful of it. Like my partner said, when we came back and we went to see Alfie's neurologist, he said, why aren't you excited about this? Alfie's gone from having hundreds and hundreds of seizures a week to none, pretty much none. He was like, you should be excited, but they're not excited, they're terrified. So that's why I work with the Medical Cannabis Clinician Society in the UK to educate doctors, educate allied health workers. I want people to be informed and empowered, and then hopefully they'll make better decisions for their patients. And that's, it's a long journey though, unfortunately, and access is still very limited. There's only 3 NHS prescriptions at the moment in the UK, and it's been legal to prescribe for 2 years since our campaign. And then there's private prescriptions now. There's clinics where we can access private medicine, but that's very, very costly. And there's around 2,000 prescriptions for private healthcare, but that's just not fair on people. It's it's not fair.
A lot of money.
Yeah.
People who.
Yeah, they call it I believe the dispensaries in our country, and that's what they call it. That's outside the medical realm. Basically your general, practitioners. But it's expensive. But at the time, as it starts to help more and more people have to make that choice whether they they eat or get their medicine.
Yeah.
And it's crazy. It is crazy to come to that point.
I think the problem is that what's the difference in the UK is that we have a national health service which is free at the point of delivery. So we are very, very lucky in that sense, but we are also, as British people, very, very used to receiving all our medicine and our procedures and our operations for free. We pay for it. Pay for it through our taxes. We pay taxes and we then get healthcare. But unfortunately, it doesn't work like that at the moment. If doctors in the UK deemed and NICE, which is the National Institute of Clinical Excellence, which allows medicines to be licensed or not licensed on the NHS, they say there's not enough clinical evidence of safety for cannabis.
Wow.
Which I would refute massively. There's over 160 million people using cannabis as medicine on a daily basis throughout the world. We know that this medicine is safe. We know that when used correctly, it is safe. What we should be doing is looking at all the real world data that's available, but they will not. They will only look at what's called randomized control data, which is what pharmaceutical companies do.
Yeah.
And that's not, that doesn't lend itself to the cannabis plant, because the cannabis plant works in the entourage effect, and that's not a single compound pharmaceutical. And I think there's a lot of work that we have to do still in convincing doctors and all these medical bodies that actually cannabis is a medicine, but not as they know it, not a pharmaceutical. It's a botanical medicine.
Yes.
So it is very, very frustrating, because it's changed my son's life, it's changed my life, but it's changed my family's life. And that's why I feel so passionately about it, because it can change worlds for people, and we must, people must have safe access, as far as I'm concerned.
When you were fighting basically for your son's life, and once you came back home and you found out that cannabis is working and you're ready to preach the word, and you found all this resistance for it, and yet you have a living example of it working. How hard was it to convince the political powers that be in stating we need to really look into this? We need to have this available because these doctors wrote my son off and they were almost killing him. And I find a plant in another country to come back and then you're telling me I can't use it? Like,
well, yeah, we were actually very lucky in the sense that the media in the UK and the public were very, very supportive.
Okay.
So when I came back in 2018 and we had to take Alfie off the medicine because obviously it was illegal to bring it into the UK without a license or prescription, he became very poorly again. But I went on to, it's called BBC Breakfast. It's the breakfast news program on BBC. And I went on there on the 26th of February 2018 and I talked about Alfie and how much had it improved. And we got they had a comment from the Home Office because the Home Office were obviously dealing with it because it was a Schedule 1 drug, and they said that cannabis in its raw form has no medicinal value, and whilst we empathise with this family, we will not allow them to have it on the NHS. So that's where we began. And then we got so much public support. We had a petition that was signed by over 600,000 people.
Wow.
And we were interviewed all the time, and they really, took the case to their hearts. And in March, we met the Prime Minister at the time was Theresa May, and she actually allowed our doctors to apply for a license. I think probably because we were just making so much noise, and she wanted us to be quiet.
Exactly, go away.
Yeah, I mean, unfortunately, those who shout loudest get what they want. I'm afraid.
Agreed.
That's so true.
It shouldn't be like that because there's many, many people that don't have the ability to do what I did. And that's why I can continue to campaign every day now for the many thousands of patients who don't have a voice or don't have the ability to go out and do what I did. And I know I'm very, very fortunate to have been able to do that and to have been heard. But yeah, I mean, basically, we were just very, very well supported, and we met the Prime Minister, and then we worked with the Home Office for 3 months creating a personal licence application, which had never been done while cannabis was prohibited because, it was only research that cannabis licences were available for. And then, as I say, in June 18, we had to push a little bit more in the media, and then Alfie received this licence, and I was told on national television that he'd received it. So it was a very amazing time, and I was, we felt very blessed to be part of some, very historical moment in our country. But sadly, when the law changed on the 1st of November to allow prescriptions to be done by doctors, they just won't prescribe because there isn't the randomised control evidence that they are being told that there should be. So it's really sad, and I hope that it gets better for people because it's just not good enough at the moment. And as I say, the people that are accessing it privately for their children are paying thousands of pounds every month to access privately, and that's just wrong. People can't afford it, especially when they usually have a full-time carer as what one of the partners is usually a full-time carer earning hardly anything in benefits, and these people have had enough. They're treated terribly. Having a child with a disability is not something you choose. It's very, very hard. There's a lot of trauma, a lot of grief, and then on top of that you're having to fight to raise money to pay for medicine, and it's just unacceptable.
It is
It's
unacceptable.
very sad.
Yeah, it's like you're fighting. You're like fighting on like different front lines. It's like, oh my God, like I'm fighting everybody just for my child to survive. I have to fight all of these things, all these individuals, all these institutions. It's like almost madness.
It's sad. For what?
It is. It's really sad. And we have had people in the past say to, a lot of these families, oh, well, you should just grow your own, or whatever. But
I was about to ask you that.
I do refute that in the sense that it's not easy to grow cannabis.
That's true. It's another job.
It's illegal in the UK to do that. And if you have a disabled child, the last thing you want to be doing is growing cannabis because you don't want to be losing your child and not being able to look after them. And at the same point, I remember my friend saying, she said, I can't keep a houseplant alive.
That's true.
That's me.
It's it should be, I feel strongly that if people want to do that, if it's for their personal use, then that's fine, as long as it's safe and they're, they're not doing anything wrong, they're looking after their own health, then why not? But at the end of the day, it's not appropriate for people who are disabled or for children who have epilepsy, who need very consistent products every day, and parents just don't want to do it. So, I know that there are people that don't necessarily agree with what, we're trying to do, but I think it's something really important to understand that, we should have the right to have a choice of being able to be dispensed a product, because that makes our lives a lot easier, and we know it's safe.
True.
So let me get something clear. So in the UK, it's very difficult to get a medical marijuana card, or
basically in the UK now, cannabis medicines are in Schedule 1. So that means that a clinician on our specialist register can prescribe what's called GMP, so good manufacturing products. So that means they have to have a GMP certification.
Mm-hmm.
So that product can then be prescribed on the NHS, but it's not happening because they say there's not enough evidence.
Oh.
So the only way you can get a prescribable product at the moment is through a private prescription, so you have to pay for it.
Okay, same here.
Yeah.
If you were to grow cannabis, then that's illegal. That's still 7 years in prison or 14 years if you're caught dealing. So it's still illegal to have anything to do with cannabis unless it's prescribed.
And what about CBD?
So CBD it's a grey area. CBD. So CBD is available over what's called over-the-counter products. So it's widely available CBD all over. Okay, you can buy hemp CBD at the health food shop, no problem. There is a big problem in the UK with quality. Mm-hmm. So there was a recent study done into the quality of CBD products, and some of them didn't even have any CBD in them. Yeah. So there is a real problem with regulation around that, and that's going to be next year. The FSA, the Food Standards Authority, are actually going to bring out new legislation called novel foods, which basically says that anything after I can't remember the date, but it's classed as a novel food, so it has to be tested before it has to have novel food licensing if it's going to be on the shelf. So the CBD market in the UK is going to change hugely come next year, because there's going to be a huge amount of products that will just be taken off the shelves. I don't disagree with regulation of CBD products, because they are, at the moment, there's lots of really bad quality ones, but I think I do worry about the really good companies that can't afford to pay for this licensing will go out of business, and that's very sad. But it's a grey area, because CBD is classed as a supplement in the UK, but actually it's medicine for some people. I know people who have anxiety, for example, who use over-the-counter CBD as a medicine.
Absolutely.
So it's a very grey area, at the moment in the UK. But yeah, anyone can go and buy good quality CBD down the street, no problem, legally. Pains more. The legislation in the UK is that there must be no more than 1 milligram of THC per container.
Wow.
That's not much.
That's not much. We're allowed more, definitely more.
Yeah, more CBD than
more. We're allowed. The legal limit for us is 0.3%. So that's definitely more than 1 milligram per bottle.
Yeah, but it depends how big the bottle is, doesn't it? That's the thing as well.
Yeah, the size. Yeah.
Because we were illegal. We were one that we were using with our son. It was basically 20-1. So 20 milligrams per ml. Mm. So that's definitely more than 1 ml per bottle for sure. Yeah. Wow.
So the sort of medicine that my son is on, it's called Vedralite, which is a Vedracan product. It's a high CBD, low THC product. So that has 100 milligrams of CBD in per mil, mm-hmm. and 5 milligrams of THC. So that's nice. Why it has to be prescribed, because otherwise it would be illegal to obtain.
Oh my God.
Got it. And how's he doing?
He's doing amazingly well, thank you. I think it's really, really important to stress it's no cure.
Of course.
I'm sure, as you know, people with chronic illness get amazing results from using cannabis, but it's not a cure for him. What I would say is it has been his miracle, in the sense that I really thought he was going to die in 2016, and now he lives a full, happy life. He's just started school at a special school for children with disabilities, which was a big step for me and his dad to choose to do that, because before he was in a mainstream school, but actually he's thrived there. He loves it. They're very, very good with him. He has very big amounts of seizure freedom now. He's had 11 months seizure free.
Wow.
That's awesome. Congrats.
Breakthrough seizures, and now he's on month 6 of seizure freedom again. So we are very blessed. Yeah.
How is his diet? Because that's one of the things. And when you say that, CBD is not the all end all, and we believe that is just part of the puzzle as you put everything together to make sure he has a complete balance in life. So what's his diet like? Is he picky? Because we're starting to see our son gets picky too. But for the most part, he loves to eat, but most of his vegetables. So how is with your son with his eating?
That's good. I wish my daughter would eat her vegetables. Well, I think when Alfie became unwell, I did sort of go on this real big reevaluation of what was healthy and what was not healthy. And I think that, it just hit me as to all the things that we're told as parents that are the right thing to do for our kids, I think actually sometimes are not the right thing to do for our kids.
We're finding the same thing. We were talking about that last night.
Yeah, and I believe firmly that the one most important lesson I've learned through this whole experience is listen to your mother's instinct, listen to your father's instinct, because we know best.
Yes.
We know, especially mothers, without sounding sexist, we are, we give birth to our children.
Yes.
We know inside and out. And I had so many gut feelings about what was best for my son, and I ignored them because I thought, well, my mum knows best, she's granny, or my sister knows best, or the health visitor knows best, or the lady down the shop knows best. I felt like everyone knew best but me, because what do I know? I'm just his mother. But then I realised that actually I need to start listening to me, because I do know best. And ever since I've started listening to me, I've got it right. And I'm not saying that I will always get it right, but I have got it right more times than not. And that's because I'm his mum. And so we did go on this big journey of sort of really looking at diet, really looking at lifestyle, and, what are we putting into our children? Is that causing these sort of toxic reactions to happen? Who knows? But yes, so he's dairy and gluten free. He eats really well. But he's so slim because he doesn't eat sugar either. He has no sugar in his diet at all. That's because he doesn't want it. But I've never given him sugar or anything, and I've just tried really hard to keep him as healthy as possible. But he does eat pretty well.
Nice.
If I put carrots and peas and broccoli on his plate, he won't eat it. But if I make soups and, curries and all that sort of stuff, he'll eat whatever that is in there. So I get that to him. So, yeah, I think on the whole, I'm trying to make him as healthy and robust as possible. And I believe that's why cannabis is part of this healthcare revolution, because it builds into that change in lifestyle, because it's a natural medicine. And I think, that's why it's become so, people are so interested in it now, because it does sort of go into that way of thinking about the life that you lead and how healthy it is.
Yeah. Now, how empowering has you been, basically have been feeling once you gave that aha moment? You're like, oh, my God. And you're able to stand in front of politicians. I don't think that was ever something that in your your bucket list in life, saying, I'm going to be pushing for a bill, or I'm going to push an agenda in front of these politicians. I'm going to meet with the prime minister. I'm going to talk to these doctors. I'm going to tell them exactly. It's not something that you wake up and say, this is what's going to happen. How empowering has that been?
It's been amazing. I feel, as I say, I feel very, very blessed to have had the opportunity to fight for my child like that. But no, excuse me. I thought I'd be like anyone else, do a job, have a child, go on holiday once a year, and life would just be simple. But actually, I have got a lot of positivity from what's happened to me. And I know that sounds a bit odd because the grief and the trauma that I've also felt, the longing that my child would live, and the dark nights I've spent in hospital have been unbearable.
Yeah.
But they've actually taught me so much about myself, and they've taught me about life. And I think that sometimes when something really terrible happens to you, it really can just change your life and make you realize what life's about.
True.
It definitely does. It has for us.
Yeah, it's strengthened us. And actually, you know what? So one of the things that we've brought up in our podcast, especially with parents who are dealing with a child with a disability, especially when it's severe, that a good majority of them end up breaking up. Like marriages are, families are breaking up over it.
Mm.
And I was like, I was kind of shocked. Divorces happen, but the majority of divorces that happen, there's a disabled child in the home. And I was like, wow, that's amazing. There's a lot of parents out there on their own trying to figure it out.
I think it's about 50% in the UK of children with disabled children, the parents split up.
Yeah.
And that's one thing that I found when I was in hospital with Alfie all the time, the amount of mothers I met on their own, because the relationship was broken down. It's incredibly sad. And me and my partner have been tested to the limit, especially when Alfie was having seizures every week and in hospital all the time. But it has brought us closer together in the end. It's made us stronger. And I think that sort of life-changing event either makes you stronger or pulls you apart. And we have been very lucky that it's pulled us together, and we've, we have got so much positivity out of it. And I remember meeting this woman once when I was in a very dark place, and I was just on my own having a coffee. I think I was just having a break because Alfie was very poorly. And she told me about her husband who was very poorly, and she had to look after him because he had an accident at work. And she said, and I told her about Alfie, and she just said to me, "But darling, we know what life's about." And I've never seen her again, and I've never forgotten it. And I thought, she's absolutely right.
Mm-hmm.
When something really difficult happens to you, it does teach you what matters in life. And I see so many people sweating the small stuff, and it's just not worth it. And so in that sense, I think that it is a blessing to have a challenging situation heading your way, especially when it comes to your children, because when they're well, when they're healthy, when life is good, then nothing matters. Nothing else matters.
Exactly.
Yeah. My wife reminds me of that all the time.
Yeah. Don't worry about anything as long as your kids are okay.
So can you tell us about Alfie's Hope? So is that an organization that you created on behalf of Alfie?
Basically it was just our campaign. We're not an organisation necessarily, but Alfie's Hope is on social media. So we're on Facebook, Twitter and Instagram. And I basically started blogging about what it was like to be the parent of a child with epilepsy. And I don't really do it now because obviously I've done so much advocacy work, and I've got Alfie's license and everything. But at the beginning,
congrats on
it was about a personal story. I just needed to talk to people about how it was, because I feel very strongly that people like us, parents of children with disabilities, are completely forgotten. That's how I feel in the UK. Mm-hmm. There's a lot of focus on young carers or carers of the elderly, but what about parents who have children and have to care for them for the rest of their lives? They remain in child, for the rest of their lives. That is, there's a lot of grief, a lot of trauma, a lot of lack of support, government underfunding of services for people like us. And I just really wanted to talk about it. So it was really just a blog initially. And then we started raising money to go to Holland, and we did a petition through change.org. So yeah, Alfie's Hope was just my way of sharing what we were going through really, and getting support. And we have about 12,000 followers, which isn't huge, but it was nice at the time. We get, and there's a lot of lovely people there that I feel, have got a lot of strength from us talking about how we feel about things.
Yeah. And it like I stated before, it just empowers you with this believing in this plan to see what it's done for your child. Because we went through the same route as well, the 100 to 200 seizures a day, not sleeping, patting the floor, having him wear a helmet. in the running back and forth at doctors where they're like looking at us like, we have no idea why he has these seizures, and it's like not getting anywhere. And then it's like you're left on your own to figure it out while you're trying to balance life.
Yeah, it's really, I'm sorry, it is, it's really tough. And I think about that all the time. I know there's thousands of families like that in the UK who are dealing with that all the time, and they don't have to. They may not have to. They should have the opportunity to try cannabis as a medicine. They should, and they don't at the moment, and it's incredibly sad.
It is.
Basically based because of stigma and because of, I think a lot of it boils down to money as well, and power, and all the wrong reasons why it's not available. I would love to live in a world where people, especially those with disabilities and poor people or less fortunate people, mattered to governments. But I'm afraid we don't feel like we're there at the moment. I feel like we're hurtling backwards at the moment, unfortunately, on that front. But
I agree. I totally agree. It's always about the money. So for us here in the States, I'm not sure if for you guys, November is Epilepsy Awareness Month. Do you guys also have that?
I think so, yeah. I mean, I follow the PCDH19 page, which is the PCDH19 Alliance in America. That's based in America, and they do that in November, yeah.
Okay. Are you going to be hosting anything, or are you going to be out and about?
The 1st of November is the 2-year anniversary for the rescheduling of cannabis as a medicine. Schedule 2. So there is something called Medical Cannabis Week in the UK from the 1st to the 8th of November, which is where there's going to be lots of events on. So doctors talking, scientists talking about cannabis, because we're just again trying to educate the public, trying to sort of demystify the cannabis plant and try and get more people on side. So that's what we're doing for that. I'm also doing some campaign work with an organisation called medcansupport.co.uk, which was created by parents of children with epilepsy for education of parents of children with epilepsy and their carers, because a lot of the problem as well is that people, parents of children with epilepsy want access to medical cannabis on prescription, but they don't understand anything about it. So we're trying to empower people by education, by understanding about the plant, terpenes, flavonoids, how it works, why it works, that sort of thing. And so they're more empowered to work with their physicians on access. And we're doing some campaigning around access that week as well. So yeah, we will be doing lots of stuff to market and trying to push it forward, trying to help people access medicine on the NHS, which is the ultimate goal.
Wow. The warrior mom. I don't think that was something you were looking as part of your, becoming a mother, is that you're going to be that warrior. And now look at you. You're like, wow.
Yeah, I mean, I feel blessed to have found something I really love. I really feel, it's really important. The one thing for me that remains the same and will always remain the same is that I want to see a patient-centred industry, because we will have a sector in the UK. There will be people wanting to grow, there will be people wanting to extract and make products for prescription, but the most important thing for me is that it's patient-led and it's patient-centred. And I'm afraid I do meet a lot of people in my life now that are in it for money, and that is not acceptable for me. I mean, I understand that there has to be a commercial side to things because people have to earn money, but that shouldn't be your focus. Your focus should be people and families and patients. And so I'm working hard in trying to remind all the people that I talk to in this sector that that's what matters as well. So that's really important to me. Okay. So I feel very lucky that I found something that I really enjoy doing. I'm very lucky.
Wow. Well, there's so many questions in my mind, but I understand where you're coming from, because as parents, and we've gone through that same route, not the extent of leaving a country to find help, but really reaching out to other people in different states. So we totally understand your journey. We feel you, and we appreciate you and love you as well as, as part of this network of parents that are fighting for our child's life. If you had to tell people, who are going to be going through something that you're going through, as we've gone through, what would you share with them, for those parents who are like, should I use cannabis? Should I even consider it? What should I do? What would you want to say to them?
Well, I think two things really is educate yourself. As I say, there's a good website that we've helped set up in the UK called medcansupport.co.uk, but there's loads and loads and loads of information online. Learn about the endocannabinoid system, learn about the plant, learn about how it works, because knowledge is power and it gives you strength if you understand what you're talking about. And secondly, as I said previously, it's go with your gut instinct. And I know that sounds very simple, but so many parents ignore their gut instinct. They just think, well, doctor knows best, or teacher knows best, or and I'm not saying that you don't work with your physicians. You must listen to them, but they are also just professionals like all of us, and they get things wrong. And we must, as parents, do what we think is right for our children. And I believe that, as you say, you've had to fight for your child. And if you hadn't of, where would they be? And you have to have that faith. And I just think a lot of it is confidence and getting to the point where you just can't. I mean, mine wasn't really about confidence. I just got to rock bottom. I just literally thought, I can't do this anymore. I can't live like this. And I thought, well, I can either go and jump off a cliff or I can fight. And I'm very lucky that I decided to fight, and I just would implore any person in this position to fight, have hope, have faith and have determination and listen to your gut instinct, because you are always right.
True.
Well said.
Well said. Thank you very much for joining us. If anybody wanted to get in contact with you that may be in the UK or US and wanted to show some support, how would they be able to reach you?
Well, I'm on Facebook under Alfie's Hope. Twitter is Han, H-A-N, seizure mum. That's my Twitter handle. Medcansupport.co.uk. Or I'm also, as I said, working as a consultant for Maple Tree Cannabis Consultants, which are based in the UK. And we are working very hard to create a patient-led and patient-centered industry within the UK.
Awesome. Again, Hannah, thank you. Well, we appreciate you. Keep up the good fight, because you'll be surprised at how many people you're helping out there. And that's one of the things that we found out, just by doing what we're doing, just bringing awareness has helped out a lot of families. So please keep doing what you're doing.
Thank you, and thank you for having me, and thank you to you. I'm truly inspired by. I meet parents all the time that are pushing for this all over the world, and together we are making major changes for many thousands of people, millions of people, I hope. And so, thank you to you as well.
Yes, thank you, and your son too, because he's part of history.
Yeah, I know. It's really special, actually. I feel that. I mean, he doesn't know.
Yeah, right? I just want to play.
Which is nice. That's the way it should be. He should just be a nice, happy little boy and not know anything about it. But he is a very special child, and I'm very blessed to call him mine.
That's awesome. Well, again, thank you very much for what you're doing, and thank you for joining us.
It's a pleasure. Thank you for having me.
All right, take care.